And directly to that point, Chris, we have been hearing from many doctors and nurses here in Arizona. They fear they simply don't have enough of that equipment to protect themselves, to care for the expected surge in patients. Our Dennis Welch talked to some of those nurses today, and he joins us live. Dennis?
Yeah, and despite a lot of those concerns, there was a recent survey that was done, and nearly 3/4 of all the nurses here in Arizona, according to this survey, said they're going to continue to care for their patients despite these risks of not having the proper protection out there. Now, this survey was done by one of the largest nursing associations here in the state.
The situation is that we're not in an ideal situation right now.
Robin Schaefer responding to the continued shortage of personal protective equipment during this ongoing pandemic.
Normally we'd go into a patient's room and put on a mask and take it off and throw it away. However, that is not happening right now because we don't have enough supplies.
Robin Schaefer, the head of the Arizona Nurses Association, recently released a survey that reflects the concern nurses have about the lack of protective equipment. The first question asked nurses if they believe they have sufficient PPE, masks, gloves, face shields, etc., to care for patients safely and effectively. Only 12% agreed, while 78% disagreed. And a survey conducted by the Arizona Nurses Association shows 82% of nurses believe they will contract COVID-19 because of their work responsibilities, while 76% of them said they are committed to keep working during this pandemic.
Nurses are highly trusted by the public, and we take that trust very seriously.
Now, as far as who is to blame for this shortage in equipment, a lot of people are trying to assign that blame, but not Schaefer. Asked her directly about that, and she said that her nurses just not worried about that right now. In Phoenix, Dennis Welch, Arizona's Family.
In my extended family, I have a few nurses. Dennis, it's a calling, it's a passion. 76% say even though they may get infected, they're still going back to the front lines. That's an amazing statistic.
Yeah, well, what is also interesting too, I asked her, I said, well, there's 24% or so that said that, they may not be committed. And I said, is that a concern if nurses would start like quitting their job during this pandemic over fears that they were putting themselves, maybe their families at risk? And she said, well, to her, the biggest concern right now is that a lot of nurses themselves actually start getting infected, start getting sick, and are unable to show up and perform their duties.
Yeah, we'll continue to follow it. Dennis Welch reporting live for us tonight. Thank you.